Thank you for allowing us to brief you on some of the programs the U.S. government through PEPFAR funding has been supporting the Ministry of Health to continue, scale up, and adapt to the evolving COVID-19 pandemic. PEPFAR funded programs have continued during this time of COVID. In fact, we're working harder than ever to make sure that we do not lose the important gains we have achieved together in the fight against HIV/AIDS. We're still learning about the COVID-19 virus. We've learned, though, that people with underlying health conditions are more vulnerable to developing severe disease and are at higher risk for dying. Therefore, in order to protect the most vulnerable in our society from COVID-19 in Namibia, PEPFAR has provided technical and financial assistance to the Ministry of Health and Social Services, not only for the national COVID-19 response, but also to rapidly adapt the national HIV program to the threat of COVID-19. The goal of these adaptations was to continue providing life-saving antiretroviral therapy while reducing patient volumes in the ART facilities to reduce the risk of COVID-19 exposure. Importantly, the ministry utilized the ECHO virtual mentoring platform, which was established in Namibia in 2015 with the support of PEPFAR, to routinely communicate with all 14 regions to rapidly implement adjustments to the program. This virtual platform reduced gatherings and increased the speed at which trainings could be held, a double benefit for healthcare providers. We also assisted the ministry to develop and implement a plan to minimize the frequency of patient contact with the health systems and reduce the burden on facilities. This plan consisted of facility readiness, multi-month dispensing of antiretroviral therapy, and the expansion of community ART dispensing. Facility readiness included plans for screening and triaging patients for symptoms of COVID-19. And for those without symptoms, triaging them to either receive fast-track refills without entering the facility or holding quick small group clinical consultations in an effort to avoid overcrowded waiting areas. The ministry was already starting to implement multi-month dispensing of ARVs, and the onset of the COVID-19 pandemic simply accelerated this program. Currently, nearly 70% of patients receive 3 to 6 months of medications in one go. This is extremely important as it does two things. It keeps treatment in patients' hands and it keeps patients away from the facilities. Not only can patients receive medicine for longer, they can also now receive their medicine at a site away from their local clinics. More community ART dispensing sites have been established through new community-based ART points, primary healthcare outreach points, community adherence groups, and home delivery. Outreach points have been placed along the northern border to ensure all patients had access to uninterrupted ART. Many other HIV treatment services like DREAMS, key population programs, voluntary medical male circumcision, cervical cancer programs, HIV testing services, community adolescent treatment supporters, TB preventive therapy, and prevention of mother-to-child transmission have been adjusted to prevent transmission of COVID-19 by minimizing patient contact with health facilities to limit possible exposure while still ensuring the services continue. Community programs supported physical distancing and use of alternative methods of communications like virtual platforms such as Zoom or Skype, phone calls, social media, etc. And group activities were limited in size according to Namibia's national COVID-19 guidance for gatherings. These rapid adaptations supported by PEPFAR helped to mitigate transmission of COVID-19 and ensure the continuing of essential HIV services while maintaining a safe healthcare environment for clients and staff during the pandemic. We're grateful for Namibia's continual partnership with the U.S. government, and we look forward to continued success together as we battle not only HIV/AIDS, but COVID-19 together. Thank you.